Hello and welcome to day 13. So today we're going to talk about the bones in the lower part of the body, the pelvis, hip, thigh, knee, leg, ankle, foot, and toes. So the lower part of our body, of course, supports the body weight and movement. It is a very common site of injuries and surgeries. Our lower body is essential for standing, walking, and balance. You'll see these structures used in orthopedic, emergency, and surgical documentation. One thing to note that when you're coding these conditions, laterality, is it working on the left side? Is it on the left side or the right side? It's very important to know which one that is, like right foot, right knee, left knee. The pelvis and hip joint. So the pelvis supports the spine and upper body. The hip joint then connects the pelvis to our femur. It's also the ball and socket joint, and that allows a wide range of motion. The pelvis protects pelvic organs, and it supports the body weight. The hip joint is the most commonly affected by fractures and arthritis, and that's why as people age, that hip joint, which is that ball and socket, wears down, and that's why a lot of older people have to have hip replacements. Femur and knee joint. The femur is the thigh bone. It's the longest and strongest bone in the body. The knee joint connects the femur, the tibia, and the patella. It allows bending and straightening. So your patella is your bone in your kneecap as well. Femur fractures are serious and they often require surgery. Knee injuries are very common, especially in sports and aging populations. So that's another one that as you age, your joints and your tissues wear down. So like in your knee, because you use it so much, they wear down, and that's why a lot of older people have those knee replacements. Leg and ankle joint, your leg bones are your tibia and your fibula. That's below your knee. Your ankle joint connects the leg to the foot. It supports balance and walking. And of course, that ankle joint allows up and down foot movement. The tibia is the main weight-bearing bone of the leg. So you got the tibia and the fibula. The tibia is the bigger one. Conditions of the leg that you'll see a lot are ankle sprains and fractures. You'll see that a lot with the legs and the lower extremity. Foot and toes, they contain many small bones. Once again, they provide balance and support. They include your toes, which are also called digits. It's a common site of chronic conditions. So in your feet and toes can have chronic conditions like arthritis and things like that. The foot has multiple joints, and that's why injuries and arthritis are very common. Conditions such as bunions and toe fractures are often seen in outpatient care. So most procedures that are done on foot don't require you to be an inpatient. Don't require the patient to do inpatient. It can be done outpatient. Always must know when you're coding which toe is affected and whether it's the right or left foot. So we talked about that laterality, right or left, but you also need to know which toe is affected. Your toes are numbered. And if you look in the very front of your CPT manual, you will see that they all are given like a modifier. So that's how you would show which toe is being done, treated in that procedure. Different terminology that you'll see the ARTHRO for joint, ORTHO for bone, fracture, of course, and arthritis, joint replacements. You do see a lot of imaging, x-rays, and MRIs because with the bone being internal and the physician needs to see exactly what the problem is. Typically, an x-ray or an MRI is going to show that. Conditions may be acute or chronic. So acute condition is always like an injury that heals up really quick, or not really quick, but it heals up and you go on about your business. Chronic is like arthritis. That's something that goes on and on and on. You've had it for a while and it's still there. Procedures can range from imaging to surgical repairs and joint replacements. So when you think of procedures, don't just think about like surgeries and repairs. Also think about the imaging that had to be done to diagnose that condition.